Yeah. So usually my age cutoff is I like to do 21 and over. Under 21's usually you're still developing. So I know some people will do 18-year-olds, but I'm usually 21 and over. That's just my personal preference because I think we're still developing. And then the script has to be stable for a minimum of a year, but the longer it's stable, the better. So, if someone comes in there and tells me their script hasn't changed for 5 years, I'm thinking fantastic. It's a very stable prescription. Then we have to also look at the degree of the script. So if they've got a large prescription, like they're very short-sighted or they're very long-sighted, that's obviously different to someone who has a smaller script. And that's important because people that have very short-sighted, generally it's more likely that they'll regress after laser surgery because there's just more of the tissue that we're ablating and the scripts generally aren't as stable. So they're all important factors to consider. And, if you're a really high myope or even a really moderate myope, you might be better off doing an implantable Collamer lens. So we do offer the different options for our patients. But I do think that ideally 21 and over, stable prescription for a minimum of a year. And then we are getting a lot of contact lens, whereas an Ortho-K wearers. So this is another interesting cohort of patients, especially Ortho-K. So if you've been wearing Ortho-K since you were in your kind of late teens, and then you come in at 27 and you suddenly want laser eye surgery, we definitely need to make sure that there's been an adequate or appropriate amount of washout time because the Ortho-Ks will change the shape of the cornea. That's how they work. So we need to definitely give it a minimum of 2 months without the Ortho-Ks in. And then usually I repeat the refraction monthly for a few visits until we're sure that it's stable because we don't want to be doing laser surgery on an eye that's still changing. So I do get a lot of inquiries about laser and Ortho-K patients, and that's kind of the schedule that I follow. But the most important thing basically is to make sure that the cornea has stopped changing shape and that the script is stable.
How about somebody who wears rigid contact lenses, like not Ortho-K, but just regular?
So still you need to have an appropriate washout time. Usually it's around a week per decade of use, but generally it's 2 to 4 weeks is a good idea to have the contacts out. And again, I do the same thing. We just repeat the refractions until we're happy they're stable. Soft contacts are a lot easier. They need to be out for at least 3 days. 3 to 5 days prior. But then again, if you're a heavy soft contact lens vision, you're wearing them from dawn to dusk, again, a longer washout period is suitable. It's very patient dependent. We get a lot of information from the refraction and from what's called epithelial mapping. So one of our scanners looks at the skin on the surface of the eye, and it gives an idea of kind of how much the contacts are impacting on the shape of the cornea as well.
Okay. And what about people in their 40s and 50s, perhaps with presbyopia? Is LASIK still an option?
Yeah, so as you know, we offer PRESBYOND here. So that's a type of LASIK procedure for presbyopic patients, purely for people that are just presbyopic, so they've lost their near vision. Or also we can combine that if they have a refractive error as well. So, they might be long-sighted for distance and also have that loss of near vision because of an aging process. So we offer PRESBYOND, which is a special type of LASIK on the Zeiss platform. There's different types on the market. That's just the one that we offer. We find it gives a really nice range of vision for those presbyopic patients. But again, if you're not a candidate for that, you may be a candidate for clear lens extraction. So a lot of 50 and over patients who aren't laser candidates for whatever reason, thin corneas, dry eyes, then they might be a better candidate for clear lens extraction. We do a lot of clear lens extraction here at Eagle Eyes. And it just depends again on suitability. But again, usually we can do one or the other.